following best describes the importance of understanding a patient's gender identity and expression in a healthcare setting? So option A says it ensures proper coding for insurance billing purposes. And no, that's not correct. Remember that here we're asking which is the best description. So best describes, meaning that's similar to when we see the primary purpose. There may be other things included that could be a side purpose, not the main purpose. But the part here about the coding and the billing doesn't really match why we would be following through with the patient's correct gender identity and expression. So we can eliminate option A. Option B says if it facilitates respectful and inclusive communication with the patient. And that sounds absolutely correct because we're being respectful and we're allowing inclusive communication by referring to the patient by the proper pronouns or gender identity that they disclose to us. Therefore, we could go with option B. Option C says it helps predict the patient's risk of developing certain diseases. And when we look at that, we have to remember that this question's asking for which best describes, kind of like when we see questions that say which is the primary purpose. Because it is possible that certain genders may have a higher risk for certain diseases, but that's not the main reason why we would want to be respectful of gender identity and expression, which does have to do with respect and communication, as we saw in option B. So we can eliminate option C here. And then option D says it allows for faster rooming and scheduling, which doesn't relate to gender identity and expression. So we can eliminate that. And that leaves us with option B, what we had chosen, which states that it facilitates respectful and inclusive communication.